So, a lot of our scapular exercises, again, like last week, they're going to be related to postural exercises. They're also going to be related to the spinal exercises that we did for cervical and thoracic. A lot of repeats. We're going to go into some specific scapular exercises today, and then show you some different progressions as well. So for range of motion, you'll notice I don't have anything listed out specifically as advanced, intermediate, and beginner, because most everything we do, we can, for exercises, just add some loading to that extremity. We can progress it by adding extra weight. We can add more intricate patterns. We can also create an unstable surface of support to make any of these exercises more challenging. So just be aware of that. So I don't necessarily have them all listed out, advanced, intermediate, beginner, because it's going to be repeating the same exercises just with weight or on a ball or something like that. With our range of motion exercises, you've already done some of those. What we did with our active range of motion and then our active assisted and our passive range of motion that we did on each other this morning with moving the scapula of your patient. Great way to get someone started, to get them understanding that they have a scapula, that it does move in these different directions, and it is controlled by different muscles, and we need to actually move them. So you can have your patient go through these things with you first, and then give them some exercises that they can do for range of motion. So if you had them in sideline and you were working on those X's or those different directions, you can have your patient then do that at home. And I will give them some visuals where they can have something to think about. So if I were doing different ranges of motion, different directions of the scapula, and I wanted a patient to do them at home, I could say, all right, we were working on your shoulder. You're fine. So we were working on your left shoulder blade moving. So what I would like for you to do is to think about your shoulder being tracing a box. So I want you to trace a big square, basically, with your shoulder blade. So you're going through drawing a square with the shoulder. Or you can also think about the X's. So we did pulling down and back toward your opposite back pocket. And back up. So they can do one diagonal direction. You can have them go the other diagonal direction. Okay, and then the one I like the best is a scapular clock. So we've done the clock with other body parts as well. So think if 12 is to your head, you can go up to 12, back down to your starting point. You can then have them do 3, 6, and 9, and keep it simple and just do 4 main points. And then you can have them work into doing all the different numbers. So fill it in. Once they get good control with 4, now do 12, do 1, 2, 3. So you can have them hit all the points all the way around the clock. If 12 is to their head and 6 is to their feet, you can have them fill in all the different numbers. And just by doing this, if you think of someone that has a really tight upper tract and they cheat every time they go to lift, just by doing this motion, actively lying down, helps to really open up this upper tract and seat that scapula back down where it needs to be. Okay, so that's an easy one that a patient can do first thing in the morning when they wake up. Okay, they can do just the 4 points on the clock. They can do the box. The box is easy to do if you're just standing up or sitting down. So someone can do shoulder rolls. They can do the box here and do it more like an upright box now. So they come forward, down, back, up. So all we're doing is making someone move their scapula. Just actively, consciously move their scapula. And you can come up with all kinds of different wonderful ways to make them do that. But I like the clock boxes, X's, things that people are familiar with. Those things seem to be most understandable for patients. That's through patient-centered language instead of trying to get them to retract or protract or elevate or depress. They're not going to know those words, so use something that they're familiar with. So those are all basic range of motion exercises. And And you'll notice as we're doing the range of motion exercises, you're starting to work on strength because we're starting to work on control, on the neuromuscular control, being able to control what motion those muscles are performing. So with scapular strengthening and stabilization, retraction and external rotation brings someone into their good position. This is your I don't know. You just did that last week. I saw a lot of I don't knows on the lab exam. So think about what Brian was talking about earlier with the forced couples and the scapula being tight in the levator scapula, upper trap, pecs being weak through the rhomboids. What position does that put you in? It's this one. It's the head forward, shoulders rounded. So we need to open that back up. So your I don't knows are perfect for that. As we talked about before, you can increase that to a band. So once someone gets that position down there, you can have them hold on to a band and do their I don't knows with a band. So that's the way you can progress that from basic, just doing the motion, to a more intermediate activity. To that would be the same thing you could do, very similar with dumbbells bent over for more advanced, or even cables, with the cable rows doing that motion. That would be a very advanced form. So for someone who needed to do that motion for a work, a sport, have them hold on to the cables and they can do, this is basically an I don't know from that position. Okay, a wall angel or a V. So think about the floor angel, the snow angels that we did on the foam rolls the other day. Okay, we can do the same thing up against a wall. So Brian's going to try to demonstrate. You need an open area of wall. So if you back up against a wall, chin tucked, you're in position, you're just trying to do a snow angel against the wall. Because if someone is tight, they're not going to be able to keep their hands up against the wall. So you're going to have them get into their good posture. So everybody do this just in a seated position. And pretend you have a wall behind you, get in good position. And you're going to need to keep your hands in the same plane, touching the wall the whole time up and back down. So that's an easy way a patient can see progress in themselves. If they can only go so far before their hands come away from the wall, and then as they get stretched out and they get better with their range of motion and their control, then they can get higher and higher and higher, and they should be able to get all the way up into full flexion, touch their hands and back down, all the way against the wall. So you can do that backed up against the wall. Then you can do the V's, so you're turning facing the wall. You're keeping your ulnar side of your forearm against the wall, chin's in good position, and you're coming up into a V, and back down. So we're working on strengthening and controlling the scapula while you're moving the upper extremity.
What does this one do?
What I just said, you're working on
I know,
controlling the
so
scapula.
this is like a strength, not a stretching. 'Cause
This
I
is
felt like
strengthening.
This was a stretch.
So they're both of them.
Oh.
So a lot of these exercises are going to cross over.
Okay.
But you're working on, our focus here is to control the scapula.
Oh, just
So
this.
normally if we reach and do something with our arm, we're going to let our scapula go. So by getting in this position, we're working on keeping the scapula in a good position as we move the upper extremity. Okay, so it's all about controlling the scapula while you move the upper extremity, so we're not just stretching, we're strengthening at the same time. Okay. All right, next on our list, scapular punch with progression to ABCs and supine. So the serratus anterior is going to be the muscle that creates a punching motion from the shoulder blade. Okay, not just from the elbow, but from the shoulder blade. So we can work on a punch from a supine position. So just punching straight forward.
It's almost like a jab.
It is.
It's like the jab from boxing.
It doesn't take any real arm strength. You're just balanced here, but you're using your serratus to punch forward. So we can add weight to that. So then
Got a
that's
big one
more.
just for you.
Ooh, all right. We need that. So you can have someone engaging the weight.
Elbow stays extended.
Elbow stays extended the whole
It's a
time.
jab straight forward.
Then you can also have someone work into ABCs, as we've done with the neck, with the foot. So you're having them punch, hold that
You'll maintain
And
the
do
jab
your
position
ABC.
while they do something mildly
And
dynamic.
that's fatiguing, so I would back them back to
Sorry,
weight
it's pretty heavy, sorry.
and do it there. Okay.
Like,
And then we'll get into more of that here in just a second as well, against a ball or a plus. So we'll talk a little bit more about that punching. Yeah.
With your week on.
Patrick's doing a little punch with the band in upright. I always start people in prone or supine if possible to work on control, because you're controlling their posture indirectly or passively, so the patient doesn't have to control it. The first thing that happens here, you see the head start to go forward, so then they lose the posture. But if you have someone in a supine position, so I've done that band exercise, so holding both bands and pushing in supine to start off with, until someone can get good control to the point that they can be upright to do it as well. So if the spine is stable and supported, it's going to be easier to start off with for a patient, and then you can work up to upright or other positions.
Did you ever see like a hanging from a bar, like a pull-up position, and then just?
I say maybe 10% of my patient population
Well, yeah,
can do that, because they would have to be able to have the strength to hold anyhow, so that's a significantly more advanced.
hard one.
activity.
Jeez,
Yeah.
I'm trying to think how I would do that.
Yeah, yeah, that's a hard one, so you factor body weight, then and grip, so yeah,
That's
that's
a
much,
tough one.
like we're done, we'll do some things with the bands, but yeah, keep it a little more controlled for our rehab population.
I think our patients have a hard time, like having the body awareness to do the reversal of muscle action with that too, that would be hard.
Mhm.
I don't know, it's easier to do the jab than to pull the jab in towards you.
As they get more advanced, I have a lot of patients who will want to work into the gym, or if you're at a physical therapy clinic that is within a gym, I will take them down to the gym and get a lat pull bar and just work on the lat, or just the scapular piece first, before I ever have them do the full lat pull. So that's how I would do that instead of reverse action. I just have them just pull the scapula down first. All right, so here's one of my favorites, the prone scapular retraction progression. Many different PTs have many different progressions, many different positions that they like, but getting someone in prone, so they're already in a nice supported position. So before you ever do the arm hanging off, let me have you scoot onto the table. I don't even want you to lift anything yet.
You can see
So
the
for
big
my
orange ones.
first starting position for a patient, if they really don't have any scapular control, I'm gonna have them here in prone, hands are palm up next to their side, and all I'm gonna say is, I want you to lift the front of your shoulder off of the table and think about pulling your shoulder blade down and back and putting it in your opposite back pocket. Hold it for a couple of seconds and lower back down. That's where I'll start. That's basic A1. That's where I'll start. They're only working proximally at the shoulder. They're not even lifting an arm or a hand or anything at this point. So they're just going to be in that position. So just lifting the shoulder, just anterior shoulder lift off the table. Okay. Then you can have them, go ahead and get back into position you were before. Thank you. Then you can have them, again with no weight, just the weight of the arm. You're going to pull the shoulder blade down and back again, and just lift the elbow at your side. So just here. And lower back down. So lead with the shoulder blade, like you're starting the old lawnmower. Do they even have pull lawnmowers anymore? Yeah.
Oh, yeah.
Mine plugs in and I just go like that and it goes, so otherwise I wouldn't mow the yard. So you can have a short lever arm, so you're just lifting from the elbow. If they lead with the shoulder blade, we're just doing a row from this position. Okay, so shoulder blade, just a bent elbow position. Then you can go into, think about, you can do varying angles at the shoulder. Again, if someone doesn't have good shoulder range of motion, I'm not going to have them lifting forward in this position if they can't do it just standing up. So I'm going to keep everything below 90, and you'll see some variations with short lever arm. The third circle here is scapular retraction, I, T, and Y position. Christina adds a W in 12 of Witties, so you'll hear Witties. But you're going to have an I, a T, and a Y position. So think about what positions you can do with your arm. Some people call the Y pulling straight back to their side. So long lever arms, you just pull straight back and back down.
I think that's what that was, the eye.
Yes, the I.
Looks over the eye.
And then your T, you're going out to the side. Okay. And then your Y would be in a scaption angle. So if you're just working asymmetrically, so I would say if Brian's right side is the issue, we can just do the right side. If it's both sides, we can have someone at the corner of the table, so turning, thank you, turning at the corner of the table of the bed, and have them off, and you can work on the T's and Y's in that position. I'll even have people over an ottoman, a little footstool ottoman, so they can do the I's, T's, Y's. We can have someone over the ball to make this more advanced. I know that's a little small ball, so you're not gonna be able to really get it. So you have somebody over an unstable surface that's gonna make this even more challenging. You can also, if someone's not able to get completely prone, I can have them just in this position. So if they can maintain this position and do some of these activities, if they're not able to get fully prone, or they can be in quadruped. So I can just have them here and do these motions. Okay, it's again not going to be as stable if their torso is not on the table. So that's only if someone does have good core strength and can maintain their spine position if they weren't able to get prone to do it. Becky, you have a question?
Can you do it instead of making it an unstable surface, can you do it on the table and add like little hand weights?
Yes,
Okay.
absolutely, absolutely. Add weights, so to progress in these, add extra resistance, so we're already using gravity, so we're at a maximal gravity resistant position. We can add weight to it, we can add the unstable surface to it. That's all going to progress these into more intermediate to advanced exercises. So these are pretty popular, you'll see that. And the W, if it's a witty, it's doing this position right here. So elbows in your back pockets, so there's your W.
I guess this is the wrong kind of. That's shoulder, not scapular.
Right, that's going to be your initially scapula, but then you're going to add in some extra rotation, so that will be next week. Okay, so go home and practice some witties, see if you can do that, see if both of them are under control. And these, very, very, very careful progression, adding 1 pound of weight to the distal extremity, a long lever arm, is a significant increase in resistance. So even if you have, I remember this one wonderful, wonderful guy, I loved working with him, but he was always very gung-ho. Oh, give me a 5 pound, give me a 10 pound. Come on, don't make me sit here in the middle of this gym with a half a pound weight in my hand. And so eventually I just said, okay. And 2 repetitions, and he couldn't keep his form. So sometimes you have to let them, just to teach that, no, 1 pound is all that you can take at this time. You will work your way up, you will progress there, but at a long lever arm, adding just 1 pound of weight is a huge, huge increment. So be careful and cautious with your progression. Try to increase your repetitions and your sets initially, and then go back and start adding some weight. All right, so band stabilization progression. Another really easy progression for folks to do. If you're in supine, you can work through, I'll do it this direction so you can see me, you can see what order I have. So I have them listed as bilateral or unilateral external rotation. So, what does that sound like?
I don't know.
Yeah! So I can do I don't knows from this position.
The difference is with the I don't know, we're cueing the patient to actually perform scapular retraction, whereas here, it's, if you don't cue them to, they don't necessarily do it. You have to cue them.
Yes, so this wouldn't be your starting point. You would have them work on the I don't knows already in their posture, and then I tell them, all right, pinch your shoulder blades together, and now pull your hands out to the side. And you can do just one side. Now if I'm just doing my right side, is my left side doing nothing?
No.
Exactly. And my left side is stabilizing, so it's resisting going into internal rotation, so my external rotators are already getting tired on my left side. So you can do unilateral or bilateral on this one. Okay, so everybody grab your bands and just do it in an upright position, so just in a seated position. These are going to be more of an intermediate if you're adding resistance band. For some people, just the yellow is going to be fairly basic, but I'd say anytime you're adding some band to any of these scapular exercises, it's going to be a little more intermediate. Okay? You can play around with the hand position. Some folks are going to have to make loops on the band so they don't have to wrap it around their hands. Some folks I'll have put it through their fingers, so thread your band through the fingers, so then they're not getting a twist or rotation of their forearms. Okay, so just depending on what hand position works best for your patient.
I know, you get the powder all over. Trust me, you want the powder on there though.
Alright, so do a unilateral row. So now elbow or your shoulder blades are down and back, held in position, lock your left arm at your side, and just do the right arm external rotation. See how that feels. Elbow stays tucked. If your patient has a hard time keeping the elbow tucked, you can put a towel there. We'll go over that more next week. But our goal here is to keep the scapular retraction position. Okay? So unilateral or bilateral. On our next one, we're going to do flexion with outward tension on the band. So all that means is you're going to wrap up the band so it's about your body width or hip width length. So your hands should be on either side of your thighs. Pinch your shoulder blades, hold them in position. You're going to pull out slightly on the band. Maintain that same slight tension on the band as you flex and extend.
Would you ever do like dislocates or anything like that?
No.
All the way down? No.
If you're a baseball player, a swimmer, and have shoulder issues for the rest of your life,
Are you kidding me? There's something functional.
I will be officiating the U of O javelin, and those guys do that with their javelins all the time, and I know they're all going to be for therapy in the next 10, 20 years.
Looking forward to it.
Job security,
Yeah.
yes. Their elbows are already shot, their knees are already shot, and they're fine. All right, so can you tell the difference just by pinching the shoulder blades? Just giving that cue of pulling slightly outward on the band almost forces you to engage the scapula. It forces you to engage rhomboid. So as you're lifting, you start to feel a little burn between the shoulder blades. It's not just a flexion motion. By keeping that constant tension, you're engaging the scapula. So that's the cue to the patient. Keep that constant tension on here. Unilateral extension or bow and arrow. Okay. So if you wrap your band up, hold one arm still, pull back like you're shooting a bow and arrow. Okay, I usually keep people in a good position and not fully rotated, so hand forward instead of out to the side. For average people, if they are someone who is a hunter who uses a bow and arrow, you will actually get into that position and train from that position. But just to start off with, just your elbow or your shoulder at 90 flexion, and work on the different elbow positions. You can come down, you can come to 90, but working on unilateral motion. So again, even though you're only pulling with the right arm, your left arm is getting a heck of a workout, stabilizing, holding still. So I'll have people do both sides so they get different work on different sides. Okay. So also remember, this would be starting in supine. So the patients are in good posture to begin with, and then you can work them up to being upright. And our last one on here is a bilateral alternating X. So X one direction, X the other direction. So this will lead us into some of our PNF in a couple of weeks. Just have them do an X. So these are things that patients can visualize. Oh, I'm making an X. I'm shooting a bow and arrow. These are things that typically most people can understand pretty easily, whereas throwing something P and F at them or do this diagonal pattern seems overwhelming. They don't quite
Staying
understand.
alive.
But if you just say, remember you're staying alive, or just make a big X in your band, people can usually say just that.
These are with extended elbows, it doesn't matter.
Typically with extended elbows, typically you can keep the elbows soft, you can't really do it with
Yeah.
flexed elbows, it's too short of a motion.
Can you just cheat?
Alright, so band rows, lots of different ways to do rows. You can do a unilateral row.
I don't think it's gonna hold.
Okay, so you can do a unilateral row, you can do an elbow to the side, you can do varying degrees up to 90. So you can do different rows with elbow flex. You can also do a row with elbow extended, that's going to be harder. Okay, you can do bilateral rows. So I've got a knot in this one, so you could actually put this over the door and shut it at home and work on some downward facing rows.
If you buy the bands, they have like little things you can slip
And a little anchor. I'll work on posture with someone and say just start with a short lever arm, bilateral row. You're keeping everything nice and still, pitching the shoulder blades together, making sure they're not going here. That's where people are going to go, is they're going to pull so hard that they get their chins poking forward. So get them in good position. Knees are bent.
Trunk
Here.
and pelvis stationary.
Pelvis is, yes, everything is in a good power position. You can do elbows extended row.
Unilateral alternating.
Exactly.
Done that
Yeah,
before?
I've had people do a full squat in a row. You could do up here. This is much, much harder. Going up here to the Y position. But you can have someone just take a piece of tubing or band home, stick it in the door. Very portable, very inexpensive. If it's someone that travels, they can take that with them. It's a easy little portable gym. Let's see, push-ups plus.
Oh, I thought you were gonna do a wall walk.
Next.
This
Oh, it is. Wall walk. This one's hard. Super, 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 super hard. So everybody, I want you just to get in this position first. So just sitting or standing. Elbows are forward. Okay. 90, 90, 90 flexion, 90 flexion. Right here. Your ulnar forearms are going to be up against the wall. Chin is down. You're going to, just like the other band flexion exercise, you're going to have a band around your arms and you're going to be cued to pull outward with your hands. Okay? I want you just to assume this position and take 3 or 4 little steps up, 3 little 4 steps down. Okay? So then what we would do is we would actually put the band around someone's arms, a nice loop. Elbows are 90 in front of you. I'm cueing the patient to pull out with the hands and step up and step down. You have to have a full loop. You can't just have it really looped around your hands very easily. You have to have a full loop to get a good feel for this one. So chin is down, shoulders are back, and you're walking up and down the wall. So you have to maintain that vertical position of the forearm. And it's very challenging. So all I ever do with this is usually 3 steps up, 3 steps down, 3 times rest. 3 by 3. And then do that 3 sets. And that's usually enough to get even pretty strong people feeling the pain. Okay.
You said 3 reps, 3 set again?
I do 3 steps up, 3 steps down, times 3 reps,
Okay.
and then rest and do 3 sets total. So 3 by 3 by 3. Yes, so loop around the arms. The key is keeping the vertical position. So you have to keep the constant tension outward on the band in order to get the scapular engagement. Otherwise, this isn't going to do the same thing as this. That one's tough. Yeah, I'll leave this loop here so at any point. A lunchtime challenge if anyone wants to do the band up against the wall. Alright, so push-ups plus. So pretty much everybody's done a push-up. Basic push-up where your arms are extended. But the plus part is what engages the scapula. I'm in my push-up position, we just did the serratus punch a few minutes ago. That's all that is doing the serratus punch at the end of a push-up.
Doing the show.
So we're starting vertically first, so you don't have much resistance with gravity, and then you're slowly working people down to where they're in a full push-up position. So you do a push-up, and then you do the plus. Okay? So you're really, really protracting or
I'm
abducting
not doing
the
this.
scapula.
I'm keeping the elbows relatively extended. I'm rounding my back almost to kind of. Yeah, it's kind of like rounding your upper back.
So you're forcing your scapula into a protracted position. You're protracting at the end. So not everybody's going to be able to start there. Nobody that's coming to therapy is going to start there. They're going to start up against a wall. So if I have the wall, I'm going to do my push-up and then my plus from an almost vertical position. Okay, once they can get the hang of that, then we can move them down to a counter. So they can do a push-up and then plus from a counter height. Then you can get them more horizontal, so they can be on their knees. You can have them on the ball, over top of the ball, doing the push-up plus from there. So the ball's going to add some instability. Then you can work them up to doing the push-up on the ball with their hands on the ball. So that's going to make it even more challenging.
That's definitely a discharge visit.
That is.
I've never done that before.
That is. Oh, I have.
Oh, yes.
I've seen a lot of athletes in this area, so a lot of the throwing athletes, they need a lot more scapular stability, and they need extra, so they're 5 out of 5 have to be functional for their sport. This isn't necessarily for accountants or people who are going to be on the phone doing normal, non-athletic moves throughout the day. Okay, so think push-up plus.
On a referral basis, primarily octogenarians.
Yes.
I see a lot of
Yes.
70 and 80-year-olds.
I've not had any.
We don't do that,
I've
but
not had anybody
I
else.
see the
involved in
value
that.
of it, though, and I appreciate it.
Yes. All right, so chair dips, chair scapular depression. So works nicely on chairs that have arms. I don't have long enough arms to do just on the end of the table. I think you might be able to. So just do the sitting version first. Can you do that? Lay it down.
I mean, just
Yeah, so just push. Oh, okay. So just pushing up. So if you're in a chair, just pushing yourself up. This is like unweighting yourself. If you were in a wheelchair and you needed to unweight yourself, unweight your backside, just pushing up. If you have shorter arms, they make push-up blocks that are blocks or little handles that you can put next to your side so you can just push and lift yourself up. So if you're in a chair, you can put your hands on the chair and push. If you have arms on the chair, then you're going to start from an even higher flexed position. And then what Brian was getting ready to show was the more advanced version of a dip from this position, and you're doing the plus.
hard work.
So you're getting triceps, you're getting a dip, but then you try to do that extra little depression at the very end of the motion. So again, that's probably not one that I have many people doing through therapy, but I do have them on the chair. I do have them pushing, doing that scapular depression, kind of a dip motion, working on scapular depression. All right, and then PNF. We'll go through the actual PNF diagonals in a couple of weeks, but we talked about doing the scapular motions and doing PNF components to them. So push me up, pull me down, push me up. So you're resisting through their diagonal motions of their scapula. You can do what we did, like alternating isometrics, what we talked about previously with PNF with the lower extremity.
Let's just do it real quick.
So if I'm working on doing the scapular punches and having Brian doing his ABCs and such, I can have him get into this position and do the PNF alternating isometrics or rhythmic stabilization. Say, all right, hold it there. Don't let me move you. Don't let me move you. Hold it, hold it, hold it. Don't let me move you. Hold it, hold it, hold it, hold it. Oh, you're kidding. Hold it still. Hold it still. Come on, Statue of Liberty. Hold it, hold it, hold it. And relax. So again, I can have him close his eyes. I could do varying degrees. I could do varying resistance and speed, so I can have someone start at 90 degrees, and then I can move them through different range. We'll talk about that more with shoulder, but you're really engaging that scapula and the rotator cuff at the same time on that, okay? And then we'll do the PNF diagonals in a couple
2
of
weeks.
weeks, and you can see the diagonal motions, what we're looking at for our motions, how we can add a weight, how we can use resistance with a band. We can progress from there as well. Same type of motions that we did with the lower extremity, just transferring it to upper extremity. Okay. Any questions on those? I want you to take your band so you can practice these.